Hello and welcome to Healthy Living on Trust TV. I'm Aisha Salihu. On this episode of the program, we're beaming our light on the little humans. All newborns require essential care to minimize the risk of illness and maximize their growth and development. Warmth, normal breathing, mother's milk, and prevention of infection are the basic needs of normal babies at birth. However, some medical conditions are often attacked, especially immediately after the birth of some babies. For new mothers who may not be aware of what is wrong with their babies and oftentimes seek non-clinical help, well, that practice may be causing more harm than good, as it is expected that all health concerns regarding children be handled by a pediatrician, who manages the physical, behavioral, and mental care for children from birth until 18 years. Neonatal jaundice has been very common in babies. Around 60% of all full-term babies and 80% of preterm babies contract jaundice during the first 2 weeks of their birth. The causes, symptoms, types, its complications, and of course, the treatment procedures will be dissected by Dr. Zainab Mimi Yaro, who is a defender of the little humans. Jaundice is one of the earliest diseases known to mankind. It comes from the French word jaune, meaning yellow. It was once believed persons suffering from the medical condition jaundice saw everything as yellow, but this is not true. Jaundice, also known as icterus, is a term used to describe a yellowish tinge to the skin and the white part of the eye that is caused by an excess of bilirubin in the blood. Jaundice is a sign of an underlying disease process which may be caused by several different disease processes. It is helpful to understand the different causes of jaundice by identifying the problems that disrupt the normal bilirubin metabolism and excretion. It could be predisposed by malaria, sickle cell anemia, spherocytosis, thalassemia, glucose 6-phosphate dehydrogenase deficiency, G6PD, drugs and other toxins, and autoimmune disorders. Common signs and symptoms seen in individuals with jaundice include yellow discoloration of the skin, mucous membranes, and the white of the eyes, light-colored stools, dark-colored urine, and itching of the skin. However, it may result in additional signs and symptoms which include nausea and vomiting, abdominal pain, fever, weakness, loss of appetite, headache, confusion, swelling of the legs and abdomen. Some other symptoms that may be seen in newborn include poor feeding, lethargy, changes in muscle tone, high-pitched crying, and seizures. The underlying medical condition causing jaundice can in some cases be prevented. Some preventive measures include avoid heavy alcohol use, avoid medications which may prevent malaria before traveling to high-risk regions, avoid high-risk behavior such as intravenous drug use, avoid potentially contaminated food and water, maintain good hygiene, avoid medications that can cause hemolysis in susceptible individuals such as those with G6PD deficiency. The prognosis depends on the underlying cause. Some conditions are easily managed and carry an excellent prognosis, while others may become chronic and require lifelong physician supervision. However, some locals refer to jaundice as yellow fever, and in some languages, it is addressed in different names. Hausas in the northern part of Nigeria refer to it as shawara, while Igbos call it anwotutu, while those in the south region, the delta part of Nigeria, refer to it as osaworare. However, jaundice remains a condition that should be given immediate attention, either in adults or in children. So speaking of healthcare for little humans, there's been this medical condition, jaundice, for newborns. What is jaundice?
Jaundice, just lightly put, is yellowish discoloration of the eyes and then the skin. Now, what happens is there's a breakdown in the blood. We have a component called the red cells. So when it's being broken down, the end product usually is bilirubin. It's a pigment, right? And most times it's being excreted from the liver, it goes into the urine and then the stool. So in some instances, you have a problem where either it's excretion that's getting it out, or it's being produced too much, or it's being broken down too fast. And then rather than going out as it's supposed to, it begins to manifest on the skin and then in the eyes. So basically that's jaundice, simply put.
To the best of my knowledge, jaundice, babies get it from the womb. It's as a result of the mother, inability of the mother not to take care of herself when she was pregnant. So when she gives birth to the baby, the baby will have jaundice.
First, their eyes will be yellow. That's the major symptoms that I notice. That's the major one. I don't think there's any other one. I don't think so.
If a newborn born baby, if you notice the baby eye is yellow, that's jaundice.
So what are the types of jaundice?
We have what you call the conjugated jaundice and the unconjugated. Sometimes refer to it as the direct and then the indirect. We usually differentiate it based on the day it appears in the newborn. Does it appear before 24 hours or after 48 hours? You know, when we look at the thing in the lab, that's the result itself, the values of the bilirubin. That tells us which type of jaundice it is. And the different types have different causes and they have different types of management. So yes, we try to differentiate it from the onset to know how to manage it precisely.
So what are the causes of this jaundice? Because it seems to be prevalent.
When we talk about types, you know, we have the direct and indirect, but then we have the physiologic and then the pathologic. Now, physiologic simply means that, okay, this is something that happens naturally, right? And then we're not too worried about that one. And then we have the pathologic. Pathologic means there's something wrong, there's something causing it. Now, for the physiologic, most times, because in newborns, like I told you, it's the red cell that is being broken down. So in newborns, they usually have a higher red cell mass than adults. And those red cells have a shorter lifespan than adults. So because it's higher and has a shorter lifespan, it's being broken down earlier and there's a lot to be broken down. So the bilirubin is a lot. And now their livers are immature. So even the enzymes in the liver, they're not enough to break it down because you need them to break it down. So that causes it to accumulate. And then for a newborn who is exclusively breastfed and, you know, is not taking a lot of fluid, that too causes a delay in excretion of this bilirubin. They're just like, it's a milder form of jaundice, the physiologic type. And that's the type we look at the levels and we decide, okay, this is one we'll just watch and see, keep repeating the test to see if it's increasing or coming down. But for the pathologic, on the other hand, it's mostly caused by a problem. For instance, if the mother's blood group is O and perhaps the child is B, okay, that's what we call ABO incompatibility. Then we have the rhesus incompatibility. Perhaps the mother is O negative. She had the first baby which was positive. That baby is fine, safe. She didn't have an injection we call the ROGAM, the anti-D, and she has another baby who is positive. Now her body will begin to attack, simply put, the newborn's body, and then the red cells will begin to get broken down very fast. That could cause jaundice as well. We have infections that can cause jaundice. We call it the Torches complex. We have things like disorders, like inherited disorders like spirocytosis, G6PD. You hear us asking parents, do you keep these babies close with camphor? Because if it's a boy and he has G6PD, the camphor can, you know, break down this red cells very fast. Different causes, but mostly a problematic problem. A problematic cause will, you know, cause a pathological jaundice, and that's the one we're more worried about, and that's the one, the level we have to watch closely. And most times this type will need some sort of treatment, unlike the physiologic one.
So how does a new mom detect jaundice? What are the symptoms associated with jaundice?
So basically, I like to say that whenever you're going to have a baby, make sure you go to a center where there's a pediatric doctor that could, you know, review your baby. Even if you had a normal delivery or it's a cesarean, you know, delivery, make sure there's a pediatric doctor who would review your child. Now, most times as a newborn, we're in the hospital, the first day of life, we begin to watch out for, you know, the eyes, any greenish tinge, okay? Most times you won't see it immediately after delivery. By the next day, for 24 hours, you're watching. Is it there? If it's there, already thinking this could be pathologic jaundice. So always tell the mothers, because some get discharged within 24 hours, some stay on if they had a cesarean birth, you know, and all that. And we begin to tell them, okay, look at the eyes, look out for any yellowish tinge or greenish tinge. Now, for the one on the skin, it might take more experienced eyes to see that, but we always say use natural light, because that's always best. Because if you're in a room like this, it might mask, you know, the tinge in the eyes or on the skin. So always tell them, always look at the eyes. It's a way of bonding with your baby. Every morning, during the day, just keep looking into the eyes of the baby and see if there's any yellowish tinge. But in the clinic, we check the eyes, we check the skin because it progresses from the head downwards. So in the clinic, we're able to, you know, assess and see that. But for the mothers, we always tell them to look at the eyes.
And when such child is being born, you discover that the skin color are different, are not normal, and the eye become yellowish. So such child should be taken for medical attendance to the doctors that are able to prescribe or treat, so that such sickness will not take the life of the child away, because that sickness is a sickness that takes a life of a child away within a short period of time.
So sometimes for jaundice that is physiologic and mild, the level isn't something we're worried about. We just encourage the mother to breastfeed as often as possible, because as the mother is breastfeeding, the baby takes in the milk, you know, it goes through the GI tract and is being excreted. This helps also with the excretion of the bilirubin, which causes, you know, the jaundice. So the more frequent the baby breastfeeds, the more, you know, it gets excreted. Like I mentioned, for like children that exclusively breastfed, it's commoner there because they don't take a lot of fluids, you know, unlike babies that have formula and take a lot of water. So we tell them to breastfeed exclusively. We tell them to breastfeed more often, and this helps with, you know, excreting the bilirubin. On the other hand, we have a type of breastfeeding which is called breast milk jaundice, which is a different thing entirely. I wouldn't want to confuse the mothers, but that's left for us to, you know, make the diagnosis and see, okay, this is breast milk jaundice. Would want to interrupt breastfeeding for about 48 hours. The jaundice resolves and then they resume breastfeeding. But then the other type is the breastfeeding jaundice, which has to do with infrequent breastfeeding, and that brings about the jaundice because it's not excreted as quickly as it should.
So I want to encourage the mothers out there, even giving them enough water to help out, because some mothers, in the name that they are doing baby friendly mother care, they will not give their babies water. So I think that baby need water to resuscitate themselves in this kind of sickness or ill health.
A lot has been said about the causes, symptoms, the types. So what treatment remedy do we have for jaundice?
Okay, so like I said, if it's the mild form of the jaundice, we encourage, you know, more frequent breastfeeding. But now if it's a type of jaundice that would need treatment, depending on the level, sometimes in the clinic, you know, depending on the gestational age, that's at the age which the baby was born. Was the baby preterm, right? Or is it a term baby? So that to determine the level we want to begin treatment. So most times we use what we call a phototherapy light. It looks like a box. You put it over the baby's cot or the incubator. It has bulbs in it, okay? And then the lights they're usually blue. So they have this wavelength that breaks down, you know, the bilirubin and makes them more excretable from the body. So most times if it's just mild jaundice, you know, the level is from 10 milligram per DL, like that, we place the child under the phototherapy light for a few days and we check the bilirubin level. Is it dropping? Is it increasing? Do we need to do something else? If the level is beyond that level which we feel we're comfortable doing the phototherapy, we have to do what you call an exchange blood transfusion. So most times because they're newborns, we have to put a cannula into the umbilical cord. You know, once they're born, it's cut off, but you still have the stump there. You put it in there, and then you're taking out blood and replacing it with new blood. Because the level is so high, we're worried about that bilirubin crossing the blood-brain barrier and staining the brain, which causes a lot of problems. So we do an exchange blood transfusion at that point.
But I think in the hospital, there is this thing that they give they cover them with, I think, mercury or so. There's one light like that, if they don't want to take them outside. So they'll just keep them inside that, like, incubator.
So in an event jaundice goes untreated, what are the complications?
That's something I always never want to even imagine, because I feel that jaundice is something that could easily be treated, right? So for me to see complications from jaundice is very, very heartbreaking, because if jaundice goes untreated, now if it's the mild form, you take the child home, it goes away on its own when you're breastfeeding, the baby is excreting. But if it's the severe form, now depending on the cause, if it's from infection, the infection can become very severe. You could have what we call sepsis, and then the bilirubin itself, which is just infection going around all the whole blood, you know, around the body. And then the jaundice, the bilirubin itself can cross the blood-brain barrier and stain the brain. And that leads to something we call cerebral palsy. And that is a permanent, non-progressive type of condition, right? So the children usually have a lot of problems, developmental problems. Sometimes they don't know how to sit on their own. They're unable to walk. They don't have bowel control, or they pee on themselves. And this is a lifelong problem. So that is one complication of jaundice I feel no child should have to live with. Because once you get to that point, there's no coming back. You can do the exchange blood transfusion, but the damage has been done. No matter what type of therapy, you can only improve the quality of life, but it can never reverse the damage that has been done. So jaundice, I always say, is nothing to play with. To think, oh no, it's just jaundice, my child, it will resolve. It's better you take to the hospital, let them know if it's the mild form. If it's the mild form, you're good. But if it's the severe form, it's better that treatment is instituted immediately.
You're still watching Healthy Living on Trust TV. Let's go on a quick break. We'll be right back. The conversation around jaundice is still ongoing. Let's go back to our pediatrician for more insight.
So what are the risk factors for jaundice, newborn that are prone to having this medical condition, jaundice?
So for the physiologic jaundice, most times, like I said, it's something that just happens physiologically. So it just, happens, like I said, because the red cell is a lot, and it's not something the mother, did, or the baby is preterm. But on the other hand, for the pathologic, there are a lot of things that could have been, a risk factor. So for instance, like I said, the key thing is just attend antenatal, good antenatal care, because all these things will be picked. So perhaps the mother has an infection. If she goes for antenatal, it will be picked, it will be treated appropriately. Because if a mother has infection, it doesn't get treated, it gets transmitted to the baby via, through the placenta, it gets to the baby in uterus, right? And if it's something like the mother, like I mentioned, is O negative, and she doesn't go for antenatal, she will never know her blood group. She would never know that, oh, I had this baby who is positive, I have to get this injection because the next baby that comes and is positive could be affected.
I believe it normally comes through the mother when the mother has a lot of malaria, untreated malaria. It can happen to the child after birth.
What I noticed about that one is that in case if they just deliver the baby and notice that the baby is having that kind of issue, it contact the sickness from the mother's belly before deliver the child. So for that reason, any mother that get pregnancy post cover as in cover herself well, especially the period of rain season because of mosquito. But when mosquito bite you, you have malaria, and that much malaria inside your body, you affect the baby inside your stomach. So when you give birth to the baby, then that's small issue of sickness, yellow fever, and like we used to call that one yellow fever.
And if the baby comes and there's no anti-D given, it can be very, very severe. Okay, like now, for instance, if another thing is if a mother has a baby boy who has the G6PD I mentioned, and maybe she stores his clothes with camphor, that too could affect the child. So there are many practices, that a mother can actually do or not do that could lead to jaundice. But the most important thing is get good antenatal care. Most of these things will be picked and then the information will be passed on to you at that period.
So let us move a little bit from little children, jaundice in adults. What is jaundice in an adult, and then the causes?
When we talk about jaundice in children, we're talking about neonatal jaundice. That's jaundice in children less than 28 days. Those are the neonates. Now, if you begin to see jaundice in older, even children and then adults, then you have to be worried, right? So now, for instance, in an adult, a lot of things could cause jaundice, but most times the pathology, that's the problem, is in the liver. So things like hepatitis can cause jaundice, okay? Things like alcoholic liver disease can cause jaundice. Things like for older children as well, if they have, because severe malaria is commoner in the extreme of ages, the very young and then the very old. So if they have something like severe malaria, that too can cause jaundice. So most times when you see jaundice in an adult, if the person isn't like a sickle cell disease patient, then there's a problem going on in the liver. Because most times children that have sickle cell, they usually have, you see their eyes are jaundice because, you know, the liver is affected, the spleen is affected and all that. But most times when you see an adult with jaundice, then there's a pathology going on in the liver.
I was asked to sit out on the sun. I was supposed to be discharged like 2-3 days after birth, but I stayed behind just because of that sign. The eyes were yellowish and the skin was looking a bit pale. Then the child does not cry too loud. The voice is not too loud when the child is crying. So those were the symptoms that were discovered. So I just sit out on the sun. I can't remember if any medication was actually given. Perhaps the child was given, but I can't remember any.
When I give birth to my first baby, the same thing happened to me. I put my baby in a morning sun, that early morning sun. So I did it every time. Till when I noticed I didn't see it again.
You know, in my area, they will tell you to go and get some leaves and cook it. Steam yourself and drink it. There are so many leaves they will cut and give you. And then all these local herbalists will give you some roots you will drink. And at the end of it, will still cure you too. Because you see the yellowish color of the eye will disappear.
The possible remedy, as you said, is for the mother to place the baby under the sun, early morning sun, so the baby can get enough vitamin D that will sustain the baby. And I noticed that some babies die. There is high babies mortality rate as a result of this jaundice in the babies.
If you deliver the child, you have that kind of issue that something like that is happened to the child, then for me, you would treat the child with a local medicine instead of taking the child to the hospital. Because where I'm coming from, we used to, I believe that local medicine is work fast than these drugs that they are selling to hospital now. But because when you give the child the local medicine, you will just wash everything away and keep the one that is inside the body and wash everything away. That is all.
Those days you use nchang or scent leaf. You just wash it, little water from there, then drop inside the baby's mouth, and then you bring the baby, not like under complete sun, maybe just where there is a little sun early in the morning. I learned that when you do that for a few days, it clears.
When you notice your baby eyes is yellow, when you give birth to he or her, then you put it in a morning sun, not that hot sun, just the morning sun. Then you'll be putting it till you notice you didn't see the yellow eye again.
So what advice do you have for new moms? What should mothers do in an event they have a child, a newborn that has jaundice?
Yes, so I feel, like I always tell mothers, I feel that jaundice is something that is seen as insignificant, or no, just like a baby having hiccups and they're like, oh no, don't worry, give pawpaw leaf water, no, just take under the sun. Yes, even like the phototherapy light I told you, the principle, was gotten from, a nurse who in her ward, all the babies tended to be yellow, and then she was just wondering, they didn't know what the problem was, and then she'll pick them up and sit by the window and face the sun and just sing for them. And then she noticed that it was clearing, and she informed the doctor. They did a lot of research and saw that it was some rays from the sun that were breaking it down. And they did more research, and then found out that the more effective one would be the phototherapy light. So yes, the sun rays do work, but it has to be at the level which is not significant enough to cause brain damage. So I want mothers to be very vigilant, always seek proper medical advice if you're advised, okay, take your baby home, breastfeed, put under the sun, and even the sun, there are particular times in the day that you use, okay? And don't listen to other people, oh, I use this for my child. Even between identical twins, it might not be the same. So they'll say, oh, my neighbor said she used this for her child, I'm going to do the same for my child. No two situations are the same. So always seek proper medical advice. Never, anything about a newborn, I don't want to hear my mother-in-law said, my mother said. Just seek medical advice. That's my take-home message about jaundice.
If your baby have jaundice, please, you take your baby back to the clinic. Then they will tell you what to do. When you come back to the home, you bring your baby early morning sun from 7 o'clock to 9 o'clock before you take your baby in back. From 1 month, you will do that. Then you will see your baby face will change. If you didn't notice any changes, you take your baby back to the clinic. Then they will tell you what to do back. Don't even bother yourself to add anything. Just take your baby back to the clinic.
Mothers, we advise the mother of the baby to bring the baby out in the morning. For this early morning sun, they say it's good. Then apart from that, pawpaw, unripe pawpaw, you will soak it in water, then use it, the water you give the baby. But my own candid advice for any mother that have such baby should take it to the hospital, because all this one is not guaranteed. Hospital is the best thing.
Taking proper care of the little humans is just as important as we do for adults, especially as children, they say, are the future of tomorrow. The basic development of tomorrow has to be given adequate priority today. I hope you had an amazing time on this episode of Healthy Living. See you on another interesting package of the program. I am Aisha Salihu.